All the articles you have come to love in EquiManagement Magazine are now available on the EquiManagement on Audio podcast. Each article is released as its own separate episode to make them quick and easy to listen to. Just search EquiManagement on Audio on your favorite podcast player to listen to all the latest articles.
Updates on treatment of equine gastric disease. More information continues to become available on the ever-changing approaches to managing gastric ulcer syndrome in horses. In a webinar presented by Epicure, Dr. Dave Rendell presented the latest updates. He stressed that no matter the medical approach, failure to address underlying risk and management factors will interfere with resolution of gastric ulcer disease. Basic management strategies include constant access to forage, elimination of grains, especially starches, minimizing stress in training, competition, travel, and at home, and limiting duration of exercise. He suggested offering 2 liters of fiber before exercise to provide normal matting lower in the stomach and to control mucosal exposure to acid juices. Esomeprazole. The first medication Rendell reviewed is esomeprazole, or ESO. While similar to omeprazole, or OMP, ESO is absorbed more rapidly and consistently, is metabolized more slowly, is less affected by feeding, and offers a 5-fold greater pronounced acid suppression with a longer time at pH greater than 4. In essence, ESO is equivalent to a double dose of OMP. He advised using ESO for severe cases of equine squamous gastric disease and for equine glandular gastric disease, where extended-release injectable omeprazole is not an option. It can also be used to extend treatment time after the 2 to 3 week ERIO injection protocol ends. Rendell noted that ESO use in horses is not FDA approved at this time. With this in mind, it is important to acquire informed owner consent when using non-FDA approved medications that have not completed safety studies in horses. Extended-release injectable omeprazole. Compared to oral OMP, the extended-release injectable OMP achieves superior acid suppression with a pH elevation above 4 within 24 hours of the first dose. Its effects begin to lessen by day 5, but ERIO still provides better acid suppression than oral OMP at day 7. In a study of 24 Australian thoroughbreds, 100% of ESGD lesions resolved at 2 weeks after 2 injections. 75% of EGGD lesions resolved at 2 weeks, and the remaining 25% improved by at least 1 grade. In another study of 29 horses receiving ERIO and 27 given oral OMP, 97% of squamous lesions treated with ERIO healed after 2 weeks compared to 67% using oral OMP. The researchers noted a significant difference at 4 weeks. For glandular lesions, 82% healed with ERIO compared to 50% with oral OMP. A study on endurance horses in training, 100 with ESGD lesions greater than or equal to 2 out of 4 and 88 with EGGD lesions greater than or equal to 2 out of 4, showed a 4-fold difference in healing. 79% of squamous lesions healed with ERIO compared to 21% with oral OMP. 42% of glandular lesions healed with ERIO compared to 10% healing when treated with oral OMP. At the Equine Colic Research Symposium in July 2024, a Utrecht study compared the use of oral OMP combined with sucralfate, and ERIO. The study authors saw a significant reduction in ulcer scores using ERIO, as well as using a combination of OMP and sucralfate. The most significant result of this study is that oral OMP alone did not change EGGD lesions. ERIO 5-day versus 7-day treatment. Studies have demonstrated that treating EGGD horses with ERIO every 5 days results in better outcomes than injecting every 7 days. Researchers compared 43 horses treated with ERIO at 5-day intervals to 39 horses treated at 7-day intervals. For healing to grade 0, 69% healing with 5-day interval versus 38% with 7-day interval. For healing to grade 0 to 1, 93% healing with 5-day interval versus 63% with 7-day interval. The recommendation is to administer 2 to 3 ERIO injections for squamous lesions and 3 to 4 injections for glandular lesions, preferably at 5-day intervals. When treating squamous lesions, the researchers saw no significant difference in healing between 5-day and 7-day intervals, 95% and 83% healing, respectively. Rendell said the ERIO injection can cause a localized inflammatory reaction, so it is best to alternate muscles with subsequent injections to avoid irritation. He recommends using the gluteal muscles or the neck and avoiding the pectorals or hamstring muscles. Safety studies on more than 214,000 doses demonstrate that localized swelling occurs in 1 in 20 to 50 horses. Abscesses form in 1 in 1,000 horses, and 1 in 50,000 might suffer a systemic reaction. Always aspirate before injecting. Warm the material prior to injecting, shake well to reconstitute, and use an 18-gauge 1.5-inch needle. It is important not to split the dose, but rather give all 20 milliliters in one injection site. Rendell said it's okay to redirect the needle in the same muscle group, rather than splitting the dose into 2 different muscle sites. He cautioned against using more than 4 to 6 doses at 4 milligrams per kilogram. This oil-based ERIO is not recommended for preventive treatment due to its potency. Take-home message. Treating ESGD involves feeding and management strategies as well as medication. For cases refractory to oral OMP, Rendell recommends administering oral ESO, or 2 doses of ERIO injected every 5 days. Treating EGGD requires a more holistic approach, said Rendell. He suggested potential benefit from administering other medications that do not specifically target acid suppression, such as misoprostol, a prostaglandin E analog to promote mucosal healing, sacralfate to stimulate mucus secretion and other favorable effects, and pectin/lecithin to assist mucosal protection. Corn oil, 45 milliliters daily, can also help reduce acid and increase prostaglandin E. Pre- and probiotics have not been shown to alter the microbiome, but might help keep ESGD lesions from getting worse. In summary, ERIO is more effective than alternatives, but can only be used for short therapeutic courses of up to 4 doses every 5 days. Long-acting intramuscular omeprazole significantly improves the lesion score for both ESGD and EGGD, even when these lesions had not responded to prior treatment with oral omeprazole. ERIO can also be combined with sucralfate for potential added benefits. For all GUS issues, Rendell stressed, treatment is irrelevant if management is not effective.